We're going to start talking about all the bones that are found in the human body, and this particular video is going to be about the bones of the skull for the most part. We will just first talk about just how the skeleton is divided up. The skeleton is divided into the axial and appendicular skeleton, and the skull is part of the axial skeleton. The axial skeleton forms the longitudinal axis of the body and is made up of the skull, the vertebral column, and the bony thorax. In this diagram, you can see the bones that are highlighted in green are the bones that form the axial skeleton. So again, it includes the skull, the vertebral column, and the thoracic cavity ribcage. And then at the end of the vertebral column, you'll find the bones, the sacrum and the coccyx. From the posterior side, you can see the vertebral column a little bit better. But again, the axial skeleton is the skull, the vertebral column, and the bony thorax. The skull is made up of two different sets of bones. There's the cranial bones and the facial bones. And the bones are joined by joints called sutures. Sutures are fairly immovable bones or joints, and it helps your skull to retain its shape. Only the mandible is attached by a freely movable joint, and all of the other joints in your head and face are suture joints. Now we'll go over some of the names of the bones in your skull and your face. They are going to be on a test, so definitely start memorizing the locations of these bones. We'll start towards the back of the skull. The back base of your head is called the occipital bone, and that is joined by the lambdoid suture, and it's attached to the parietal bone, and then it's also attached to the temporal bone. The parietal and temporal bones are attached to each other via the squamous suture. And then the parietal bone is also attached to the frontal bone by the coronal suture. The word corona just means crown, so that's why you have a coronal suture on the top of your head. And then when we move towards the face, you'll notice that you've got the mandible. That's your lower jaw. That's the movable part of your jaw. The part of your face that holds your teeth on the top of your mouth is called the maxilla. The bone that forms your cheekbones is called the zygomatic bone. The bone that forms the bridge of your nose is called the nasal bone. And then the bone that forms kind of the sides of your nose and the inside of your eye socket is the lacrimal bone. And then the back of your eye socket is formed by the ethmoid bone. And then you can see right in front of your temples there's a bone called the sphenoid bone. Your temporal bone also has a couple other important features. This hole through which sound travels to reach your ears is called the external acoustic meatus. And then there's also the zygomatic process, which attaches the zygomatic bone to the temporal bone. If you were to look through a skull from top down and cut the top off, you can see a few other important features. So the foramen magnum is the hole through which the brain stem and spinal cord can travel and meet. And then you also have a couple holes in the base of your skull that are important. The jugular foramen is the hole that your jugular vein travels through, for example. There's also, you can see the internal acoustic meatus, so that's where sound travels through to your inner ear. The top of your nose is formed by a structure here called the cribriform plate, and that's where the nerve endings that allow you to smell things reach your nasal cavity, and that's inside of the ethmoid bone. And then if you look at your skull from the bottom side, so you're looking at the inferior side of the skull, you can again see the foramen magnum, so that's where your spine can travel and meet your brain. And then there's two structures called the occipital condyles. Those are where your skull articulates with your vertebrae. And then you can see again the jugular foramen where the vein travels. There's also the carotid canal through which your carotid artery travels, so those are very important. You can see how the maxilla is also where your teeth are attached, and then there's something called your hard palate. That's the bony part of the roof of your mouth that is part of that bone. You can see from a different angle the zygomatic arch that is formed between the zygomatic bone and the temporal bone. And then you've got a bone called the vomer, and that forms your nasal septum inside of your nose. When you look at your skull from the front, you can see all the different bones that help to form your eye sockets. So it includes things like the lacrimal bone, the ethmoid bone, the sphenoid bone, and then even the frontal bone forms the top of your eye socket. And the zygomatic bone forms kind of the lateral side of your eye socket. Some of the bones in your skull also house paranasal sinuses. A sinus is a hollow portion of a bone, and these typically surround your nasal cavity because paranasal means around nasal cavity. The functions of your paranasal sinuses are to lighten the skull so it weighs less, and they also give resonance and amplification to your voice. That's why if you have a cold, for example, you feel like you're muffled a little bit, and it's because those resonance chambers, which normally do not have tons of fluid in them, are more fluid filled and thus can resonate and amplify less. So from the anterior side, your frontal bone has sinuses. You can see those there. And then you also have ethmoid sinuses. Those are here in green. Sphenoid sinuses that are represented here in yellow. And then maxillary sinuses, which are here shown in red. And anytime any of those get fluid filled, they can cause also a little bit of discomfort. So if you've ever had a sinus headache, you know what it feels like when there's a lot of pressure inside of your sinuses. And then from a medial view, you can see how far back they can actually extend in your skull. So again, the frontal sinus is the purple sinus that you can see. Then there's the ethmoid sinus, the sphenoidal sinus, and the maxillary sinus. You do have one bone in your body that does not articulate with any other bones, and that's called the hyoid bone. And this is the bone that serves as the kind of anchor for your tongue. It's the movable base for the tongue. And this particular bone is really important because it aids in swallowing and it aids in speech. Here you can see where the hyoid bone is located. So it's located kind of tucked in between the maxilla and your neck. And so this bone is the anchor for your tongue. So your tongue actually comes up from your throat and then to your mouth. The fetal skull is unique because it is a quarter of the body length of a baby, but your head is only about an eighth of the body length when you become an adult. And so it's really large. That's why little kids always look like they have big heads, because they do. The rest of your body grows to catch up to the size of your head. Your head is large when you're born because your brain does not actually get tons larger when you're a kid, but the rest of your body does. The fetal skull also has structures called fontanelles, and they're the fibrous membranes that connect the cranial bones. So if you've ever heard of somebody say that a baby has a soft spot on their head, that's what they're talking about, is these fontanelles. They're not fully formed bone yet because they need to be able to allow the skull to compress a little bit during birth to fit through the birth canal. And then they allow the brain to grow for about 2 more years. So the skull is going to fully fuse by about the age of 2. But the brain does have a little bit of room to grow before all of those sutures are mature. So when you look at a fetal skull, there's more than one fontanelle. The anterior fontanelle is the largest, and the posterior fontanelle also exists. But you can see the sutures that are between those bones are not fully formed, and it's so those bones can move a little bit relative to each other during childbirth, and then they can also grow just a little bit as the child grows between the ages of 1 and 2, or between birth and 2, and then after about 2, your head, the cranial bones in your head are fully adult-sized. So this is a medial view of a fetal skull. Again, you can see that anterior fontanelle, but there's also a sphenoidal fontanelle, the mastoid fontanelle, the posterior fontanelle. So those are all places where eventually the fetal skull will fuse. And you'll notice the cranial bones on the fetal skull are really large, and their facial bones are really small. That's normal. Your facial bones grow more than your cranial bones as you age.